Okay. Good morning, Rafaela.
Good morning, Rita.
Rafaela, I want to thank you so much for accepting the invite. I'm very grateful for your acceptance, and welcome to the show.
The pleasure is mine. I'm having another invitations for you as well, if you want some friends to join
Sure,
in
I'm
the
I'm
future.
open. Yeah, sure.
Yes, when I
The
talk
more the
about I was
merrier.
invited. Yes, because podcasts are very popular and useful nowadays, right? Because nobody has time to sit down and listen or read. Now you can have this tool to receive
Yeah,
information
right.
and
Like, why do you think that we lack the time now?
sorry.
Why do you think that we lack the time, like compared to before?
Yes, because I think the informations after like 10 years ago, 15 years ago, you need to see, to have a book, to have specific friends to talk about some specific topics. Now, if you need to research, if you need to improve at some topic or article or anything, or even a book, now you have all the tools in 5 seconds. Just have
Yeah,
the idea and go ahead for it. It just depends on you to be curious or
like the
to
internet now is overflowing with information, actually.
yes, yes.
Rafaela,
Scientists
just
as
before,
well.
yeah, tell me.
Science as well. I used to say to my friends and patients that science changed every 6 months. 6 months had something new. 6 months had something new to learn. Never stops.
Yeah, very true.
Mm-hmm.
Rafaela, before we start, can you please just introduce yourself, give us a little bit about your experience? What's your
Yeah.
backstory?
Yes, I was born in Brazil. I am a Brazilian. I was born in Rio de Janeiro,
Oh,
and I'm 46 years old. I will be turning 47 on September, and I am graduated nurse in 2003.
mhm.
2003. Oh, yes, 20 years ago. And then directly I joined the residency for nurses, because in Brazil we have residency for many other careers, not only for medicine. We have for nurses, pharmacists, dietitians, physiotherapists, a lot of other careers. So I joined the medical surge residency, which is 2 years training. And then in Brazil, we have a lot of exams for you to have public jobs, which pays more and gives you stability. Nobody can remove you from that or site, let's say, or job. And then I was a public employee for 5 to 10 years. And I had a lot of, around 3 public jobs there. And then after I got married, my husband and we moved to South Brazil. And then we opened our own clinic, plastic surgery clinic. I met him at the hospital. He was a plastic surgery resident. And I was the routine nurse for plastic surgery. And then we got married and moved to South Brazil. And then for 10 years, we had our own business. And then then back in Brazil, we had this clinic. It was plastic surgery. And together with us, we have a lot of other doctors, like dermatologists, vascular surgery, thoracic surgery, and a lot of allied health care stuff, like physiotherapists, chiropractic, Pilates, a lot of things. And then after seeing a friend here in Dubai, we came to visit. And then once we were visiting a clinic at Jumeirah, we received a job offer. It was totally by surprise.
Yeah.
And then he accepted the job offer. He applied for all the documents before having the exam. And then he came first. And then when I saw that everything was okay, everything was for real, I decided to come with my daughter after he was here for 3 months, like the 3 months experience. And then here we are, 7 years. Yes.
How was the ride?
Very good, very smooth. We left Brazil because it was very violent there, very unstable. So the politics, they sent you here and there, a lot of taxes. No matter how much you work, you have always to pay more and don't receive anything back. This is the problem of South America, of Latin America. And then here we are very happy.
Rafaela, let me ask you, why did you choose nursing in particular?
Yes, it was because in Brazil, the nurses have they can have a lot of holes, no matter, because it's different. Like North America, just for you to understand. In Brazil, we have nurse technician, which is a high school degree. Okay. But in case if you join the university, there's no nursing college. If you join the university, no matter if you do 1 or 2 years, you need to have the full 5 years to have the nursing degree. It doesn't happen in North America or Canada or UK. If you do like 1 year or 2 years, you receive a certificate of practical nurse. I don't know if I'm right or wrong, but I really don't. I'm not familiar with these titles because I never had this before. And then, so every time you complete 1 year studying nurses, you receive another graduation, and then until you get the full graduation. It's like this. In Brazil, no. Once you go, you need to finish. If you withdraw the program, you won't receive anything. You just waste your time or your money. And then, so that's it. And then it was a time that the thing in Brazil was very very open to new programs, to new jobs, a lot of job offers, very, very high salaries compared to others. And then I choose because I could choose more the way I should go. If I go for administration, if I go for nursing care itself, or if I go for researches or HR, everything was connected. I used to say that nurses connected all the professionals. They connect the patients to the doctors, the healthcare to the patients or to the doctors, the suppliers, everything, because everything passed through the nurse hole. So we get to know everything. It's a very, very complete job. I'm very proud of being a nurse.
Wonderful. I'm happy. So does it make you feel fulfilled as Rafaela, as a human?
Yes, a lot. Because before studying, let's say science, let's say anatomy or other subject, I was very skeptical. I was very, the things are like this because the world is like this. It is what it is. But after being in a deep study, in the deep research, I could feel that yes, there is God, there is strength, there is the energy, a lot of things, and it was a connection for me. The first
Nice.
time I saw a baby being born, ooh, I still remember that, giving goosebumps until now. And I could see that it wasn't like because only about nature. It was because there was something else behind that we can't see.
Wonderful.
Yes, it's very nice. And I don't know if you were Muslim or not. I'm not
Mhm.
Muslim, but I read a lot. And then, if I don't know if I can say, but Prophet Muhammad was the closest one to describe the embryogenesis, the
Mm.
way that the baby was developed inside the womb, and it was described in an embryologist book by a Canadian professor, Professor Moore. I still have the book because that would touch me a lot, and then
Mm.
from that day I started to study more, to see, to have another look to the things. Why it's like this? Why it's like that?
So
Yes,
sometimes like it takes you into other perspective rather than solely science. Like there's
yes,
some power beyond our understanding.
for sure.
Yeah.
Energy is everything, everything. If you want to touch someone, if you want to uh, turn the key, if you want to do something, it's not just about, okay, you need to act, you need to have the
Mm.
actions, okay, but the way that people can talk to you, the way that people can guide you through the hard ways, or the easy ways, it's just about energy, in my opinion, in my humble opinion, because
Beautiful. No, beautiful.
yes,
Rafaela,
it's not
tell
such
me.
a thing. Yes.
I'm sorry.
No, no, no. I'm just wondering. Oh, I think I
I
went too far.
no, no worries. I liked it actually. Rafaela, tell me. So, what's, let's say, the most common surgeries that do you practice over here in the UAE, or you and your husband do? I mean, in a sense, like, have you noticed any cultural differences between Brazil and over here?
Yes. Um, Here, what we can consider is the number of children, for sure. In Brazil, we have three, maximum two. Sometimes when the twins came, four.
Hmm.
Okay, but here we have seven, six. It's common, right?
Hmm.
So tummy tuck is the most common surgery for us. And then over here, also, there is a lot of post-bariatric surgery patients that it's not a critical thing, but it's more than there, I think. But in Brazil, when the girl turns 15 years old, the parents ask them, "You want breast implants or go to Disneyland?"
Mm.
And then sometimes the girls go for the breast implants. It's not a problem at all. We see youngers going because being married or having kids not their priority.
Mm.
So they are more free to go. There's no judgment. Here, I feel that yes, the girls, they do whatever they want sometimes, but they are always expecting, oh, I didn't finish my children. Maybe my husband wants more. So this is the only thing that makes them different. And
Uh,
basically, this is the most challenging thing, because sometimes the patient asks, can I do the tummy tuck? I say, yes, you can. And then the second question is, when I can get pregnant after? I said, oh my gosh.
Ah.
They don't care about if they can they need to undergo for the surgery again. But in Brazil, this is a problem. Here, no. They are very brave. Appreciate. I said, oh, I'm so covered. But here, no,
Can you
they are
tell me,
very, very
please, about the tummy tuck? Like, for
good.
example, what are the aftercare uh, instructions which people usually have to follow, ideally?
Mhm. Yes. For tummy tuck, uh, uh, we use surgical glue over the scars. The surgical glue, it's a bacteriostatic glue, so any other bacteria can grow over the scar, so there's no infection over the scar sites.
Mm-hmm.
And then I like to let the scar, only the scar with the surgical glue, for me to have a straight look, or for the patient or for the caregiver at home to see what's going on, if the color is changing. The patient needs to drink a lot of water, 50 ml times her or his actual body weight per day.
Mm-hmm.
So if you have 60 kilos, you need to drink after the surgery 3 liters of water, no matter what,
Mm-hmm.
because there will be liposuction and other blood loss, and you need to hydrate a lot. You need to sleep with 2 pillows under your back and 2 pillows under your knees to make like a V position like this, for you not to stretch the scars. And then after removing the drains, we place the garments and the board, which is a smooth compression like a phone, to make it smooth, not getting wrinkles over underneath the garments.
Mm-hmm.
But I think mostly more important than after is the preoperative, the before. The patient for a tummy tuck, for any surgery, I include myself because it is a very new training that we have. It's called functional plastic surgery.
Mm-hmm.
Basically, is to prepare the patients for the best surgical journey. So we will do a pool of exams, blood tests, okay, and then we will ask them their habits. How many liters of water do you intake? What was the maximum weight that you reach, even during pregnancy? What about diabetes, heart problem, high cholesterol? I'll go very, very deep. And then what was the surgeries, the previous surgeries that they had, if they have too much vomiting, too much pain, too much swollen, because I can predict if the patient is having some trouble to cope with the inflammation that this surgical procedure will boost in her body. Okay, because the inflammatory response is something that you need to be prepared. It's like you go to a winter trip carrying a summer suitcase. Over there, you're gonna need some heavy coats. You need to have gloves, you need to have boots, and you have a
Mm-hmm.
bikini or a short sleeves. So you're gonna suffer. So I prepare, I ask, seriously, do you make poo every day? How many liters of water do you take? You have low vitamin D. So I can see how this patient will go after the surgery, because if she's very spoiled, she's very bad in hydration wise or nutrition wise. I can see, and also I have a bioimpedance scale. It's a very common scale, but I have a medical one that I can read the body fat mass, the muscles mass, the bones, the minerals, everything. So it gives me I can see the metabolic rate. So it gives me a glimpse of how this patient is healthy, not operated. Okay, if it's a score, it's bad, even before the surgery, you can guarantee that going to the surgery without any preparation, she will have more liquid accumulation, that's called swollen. She will have more pain. She will have more trouble going to defecate after the surgery. And a lot of things. This is the mild complications. The bad complications, thrombosis, or even hematome or everything. So we can take control of this. So every woman, they need to replace vitamin C, vitamin D. I can see how the collagen is, because otherwise they cannot complain about I scare my scars are very bad. Yes, they're very bad because you only eat bad things. We need to remove all the sodas, all the fast food, all the frozen food, because this garbage will be inside of you. And if you don't make poo to throw this garbage again outside, you're gonna be stuck with all these toxins.
Oh.
And this is a problem. This is huge. We don't know how these small things plays in our body. I include myself. I didn't know about this. This is very new. This training is only 1 year. We have this training. But I remember when I went through my surgeries, even my tooth extractions were a nightmare. Because my diet was based on carbohydrates. When I was hungry, I go for carbohydrates. I didn't take that much water. I was terrible. But I didn't have this information because I'm old with gold. Then we didn't have Google. But now, alhamdulillah, we have the information how to spread.
We have all information now.
Yes, it's just for you to listen. If you don't follow, it's your problem, right? But you cannot say that you cannot receive.
The information is out there. It's up to you to choose.
Yes, information's there. The people used to say the salvation is individual. So save yourself. See? Yes, it's individual one. No matter. You can pray for me, I can pray for you, but the salvation, you need to do your part. Yes, but it's pointless. Everything is written. Everything is written. Drink that amount of water. Do the calculation. Are you drinking water? No, not that much. Oh, so what? That's why you're like this, like that. Oh, really? Oh, yes, really. Try to drink some more. Oh, thank you so much. But you need to just to push, right?
Rafaela, I need to ask you about something that you mentioned.
Yeah.
You told me that in Brazil, for example, when a girl reaches 15 years old, she has a choice. Her family asks her if she wants to go through the breast implants and such. And you mentioned that maybe because she doesn't really care about having kids and start a family. So I just have a question. I don't know if I'm correct about this or wrong. But does the breast implant affect if she's gonna have kids later?
No. Nowadays, our technique, we choose to place the implants behind the muscles. All the functional breast tissues, the glands, the fat. The glands produces the milk, the fats give the volume, okay? Are above the muscles. So once you place the implants behind the muscles, you save all these structures. You don't cut around the areola, you don't cut the channels, the milk channels, everything is preserved. So yes, they can breastfeed. In my case, I have implants for 20 years, the same implants. It was another technique. So it was around the areola and above the muscles. Yes, my milk production was very little. But then I remember that my great grandmother, she didn't have any milk and she didn't have implants. She had 8 kids, but she couldn't breastfeed any. So it's more that it's personal, you know. Sometimes I see girls without any breast tissue with a lot of milk because they put the baby to suck. Everything depends also the pumping that the baby does around the areola. Okay, if the motor is there, the stimuli for producing the milk to exit the milk is there. If your baby sleeps a lot and you don't put him or her to suck, yes, there will be a delay on milk production. Yes, everything. It's a lot of tricks. Like even when you have a low milk production, you don't need to wear the bra very often because when we were cavemen, right? You used to go naked and running. So one tip is to remove the bra for the breast, have this balance to give stimuli to produce more milk. Yes. And this is the opposite. When the baby is not sucking at all or it's hospitalized, so the mom is at home, to reduce the milk production, we go for a very tight bra or something to reduce this stimuli.
I see.
It's very
Let me
beautiful,
ask.
right?
Yeah, it's actually wonderful. I never knew about it. Like, because when you were
Yeah.
talking about, usually they have a choice of, for example, not having kids in the future. So it triggered a question in my mind. I was like, is it related in a sense? So this is why I had to ask it.
Mm-hmm. Yes, but uh, because in Brazil we have a lot of different types of weddings, right? You can live together, you can be married, you can have a stable union, which I don't get it that much. Okay,
Stable
so
union. What's stable union?
it's something very hard to explain. Stable union is like this. It's not a wedding, and it's more than a regular boyfriend and girlfriend. You live together with someone, okay, but you have the same rights as a married guy, but you're not a married guy.
Okay, that's weird.
So it's next time when you have a lawyer, a Brazilian lawyer, try to get this information because I am afraid of giving wrong information. People after that go, no, this is like this, it's
It's
like that.
Rafaela. She's the one who told us.
Yes, it's wrong. Yes, in Brazil, it's a land that everybody has some right or something, you know, like if you have a second family, your kids, your wife will be having the same rights as your first wife or as your kids. It's very difficult because sometimes you don't know the existence of this other family and oh, surprise.
Yeah, surprised I have another family.
Surprise, another family.
Just in case
Yes.
if you need to know.
Yes, but over here it's by law. Over there it's by, oh, I recognize that they have a relationship, and then they have the same rights. Yes, it's
Humans
very,
are
very
strange.
complicated. Yes, it happened to my grandfather. Terrible.
I
Not
can
about
imagine.
yes, not about this, but it complicates a lot of things. Even when the father dies, so there was a like a fight because
The
I'm
rights
the
between
I'm
kids
the
and so on.
right, you're the wrong. Yes, it was a mess.
Well,
But everybody's alive.
that's up to the lawyers to manage, I think.
Yes, but even the lawyers sometimes they need to be very creative.
Yeah. Let me
Yes.
ask you, Rafael. I noticed
Yeah.
on your page while I was doing research that there's a difference between lipidemia and obesity. Can you please
Mhm.
explain?
Yeah, sure. Obesity, it's when you have a full body uh, weight gain, okay?
Mhm,
Uh, over the tummy,
mhm,
breasts, sometimes face. You are overweight.
mhm,
But lipedema, sometimes you have a, like we call two different bodies in one person.
mhm,
Waist up, she's thin. She has small hands. She has small face. Very good waistline.
mhm,
No fat around the belly, but over the legs, over the thighs, and mostly over the calves.
mhm,
Yes, it's something that is not related to edema, water edema.
mhm,
Okay, it's a disease called a hormone cause, and it attacks the adipocytes, the fat cells.
mhm,
So after every hormonal big event of the girl, so when they got the first period,
mhm.
okay, they have a hormonal party. Okay,
Yeah.
so you have peaks of some hormones, so they can change the shape of the adipocytes. Let's say the adipocyte is supposed to have this round shape here.
Mhm,
After the hormonal exchanges, they start to be in a different shape, like tortuoso ones
mhm,
or triangular, because the collagen, the membranes, are glycated. Glycation is something that occurs in many parts of our body, okay?
mhm,
Inside of the veins, inside of the cellulites, okay? But for lipedema is the full layer of the fat cells. And then when they have the second event, hormonal event, like
mhm,
pregnancy, they can increase. If they gain too much weight, they can increase from grade 1 to 4.
mhm,
So grade 1 is basically the calves. You can see that much the anatomy of the knees, and it's a clinical exam. There's no blood test to detect the lipedema. You can
mhm,
see, once you see, if you train your eye, once you see, this is a lipedema. And then also you ask the patient, how was the first menstruation, the first period, if it increased during the first pregnancy,
mhm,
menopause, okay, and other things. At least the three major hormonal changes, they increase or they got worse. Also, they can some people they include the arms, and
mhm,
it's very annoying because there's no cure for this. Okay,
mhm,
only control. The first control for lipedema is diet. You need to eat clean. You need some supplements. Some some countries they use even steroids to
mhm,
control the the aspect of the skin. This is I like very much because this is a indication for use for steroids, not for being big or for being strong. It's not for this, to treat a disease, because this is a disease, a chronic disease. And
What's the
then
role of diet in fixing it? Like, what kind of diet should they follow to take care of this?
yes, they some of them, they refuse to follow diets.
Yeah.
Yeah, but the best one is with low carbohydrates.
Mm.
Okay, low carb diet. And then once you discover, when you are diagnosed with lipedema, first we go for some blood tests, okay, just to see how is your inflammation, because it's an inflammatory disease. How is your hormone rates? And then you can start some keto diet, but needs to be the real one. Okay, you cannot go for keto like I go for keto 2 times per week. No, it's not a keto diet. Keto diet is at least 30 days with a lot of water for you to not have the bad habits. Okay,
Yeah.
people cannot tolerate the keto too much because of the smell. You need to go to the bathroom every day. You need to wake up at the right time, to sleep at the right time. You need to put this routine in your life, because our bodies is smart and dumb at the same time, you know?
Yeah.
Yeah, so sometimes you just focus, oh, you do this, I do that. So the body got the routine about waking up. So if I woke up, I need to have that hormone. If I go to sleep, I need to secrete that hormone. I need to be sleeping to my organs got alignment. So I can secrete, I can reabsorb, I can relax, I can do everything. But these girls needs to be always under our eyes. They need to go for a dietitian, because sometimes you think, oh, I'm doing everything's great, I'm doing a great job, and then when you go up on a scale, you didn't lose any weight, so it becomes very frustrating, and then you withdraw because all that I did, it was useless. But it wasn't their fault. You know, it's a very tricky one. So sometimes every 4 weeks, we need 3 weeks, we need to exchange our exercise. Lipedema needs some specific exercise, even after the surgeries, vibration, cold compress, weightlifting. And they cannot be afraid of doing that, because this is the treatment. It's very, very, in my opinion, it's a huge mistake when you go for a lipedema surgery and you think it will be the only one. Few cases, yes, when the patient takes control about their lives, about the diet, about the exercise, yes, should be the only one. But when the patient is young, she will pass through the other hormonal event like pregnancy or menopause. She needs to understand that it's supposed to happen again.
I see.
Yeah.
Thank you so much for
Yes,
this. Actually, that's such new information for me.
yes, it's sad because I think the research sometimes could go deeper, right? Can have a shot or something, a microchip. You know, sometimes they say, "Oh, why so many years to develop such a thing?" You know, give a vaccine or something, a shot.
And just fix it. Rafaela, let me ask you again about what's mastopexy and mammoplasty. Also, this is the first time that I hear about it. What's the difference?
Yes, mastopexy, it's basically the same of mammoplasty.
Okay.
Mammoplasty is a term that we use to say that we will have a alteration of the breast, surgical alteration of the breast. So it's a mammoplasty, breast implant. This is a mammoplasty. You are changing the breast volume.
Okay.
Or breast reduction. Yes, it is a mammoplasty because you are reducing the breast volume. Mastopexy is basically when you remove skin. Pexia is when you remove such amount of skin, you cut and sew. But there is something called mastopexy with implants. When you, like, after breastfeeding, our breasts become a little bit saggy with a lot of skin without any volume because it was loose during the breastfeeding. So we can place an implant and do mastopexy together to remove the extra skin and place the areola at the right position. There is also mastopexy without implants, when you want only to remove the excess skin and put the areola on the right position.
I see.
It's only a term.
Yeah, I see. Because like also it was like something new, so I thought like I need to know about it as well. Yeah, let me also go. I need now we know how usually people should take care internally via diet, and that's how they take care of themselves. But let's say, is there any lifestyle habits which they should take into consideration? For example, sun exposure, etc., like external factors. Like, for example, stress. What's the effect on health and skin?
Yes. Terrible. Yes, stress. You know, there are some, it's a very common example. People when complain that they are waking up 3, 4 a.m. to make pee during the night. Are you having this or no?
Me? No, I don't.
So you're not stressed.
No, I'm not stressed.
So it's a,
I sleep
so
like a
it's
baby.
yeah. So that's wonderful. So when you cross 35, when you cross 40, yes, there is a massive change in your hormones, in your life, because it is very hard for you to fall asleep. You can be very, very tired, but you cannot close your eyes properly. You wake up in the middle of the night to make pee, even if you don't drink that much water. This is a classic sign of high cortisol, and high cortisol is linked to stress. As much as you got stressed, more cortisol is in your bloodstream. So that's why it's very important for you to have time to sleep and time to wake up. So yeah, also another classic sign is when the old people prefers to stay at home instead of going to party all night long. When I was younger, for me it was the perfect night. It was when I got home at 4 a.m. and then go to sleep and I wake up 1 p.m. But I cannot do this now because otherwise all my hormones would be unbalanced, and to put that back in track be a nightmare. So signs of high cortisol, like when you got stress, when you have a young baby breastfeeding and you need to be like sleeping and awake to hear the baby crying, waking up in the middle of the night to breastfeed, waking up to see if you're maybe someone that you giving care is awake. Like
Mhm.
my grandma, she's bedridden. So my aunt
Mhm.
wakes up many times in the middle of the night to check on her. Stress at work, stress at the family. But we can reduce with a clean diet, okay? Drinking water properly according to your
Mhm.
body weight, exercise, no matter what which modality, but you need to
Mhm.
exercise at least 30 minutes per day. For
Mhm.
women, yes, weightlifting, because we need to have our muscle bank. Okay, I'm a person that if I don't work out, I can miss my muscles in a blink of an eye.
Yeah.
Yes, if I make pee pee, I lose muscles like this. And then sleep. Try to sleep, at least lay down 8 hours per day in a dark room
Mhm.
without screen, without standby lights. If you are very hard to sleep, you can drink the a couple of tea, something that
Mhm.
makes you fall asleep more. And then there's some kind of supplements also with B6, melatonin, that can
Mhm.
at least put you in the right track. Because once you get used to do something every single day, your body uh, will tell you, oh, it's time to sleep. It's time to wake up. There
Mm.
are some people that they don't use any alarm to wake up. They just, oh, 6 a.m. I woke up, or 5, 7, no matter what,
Because I
because
think
you're,
their body is programmed like for the circadian
yes,
rhythm is aligned.
yes. This is amazing. This is amazing. And for women, when we have our pregnancy or breastfeeding, you can tell all these things differently. It's very, very amazing. Oh, and then you need to sleep, diet, exercise, drinking water, and your intestines needs to be in a wonderful function. You need to eat and not be bloated. You need
Mhm.
to eat and not run for the toilet with
Mhm.
diarrhea or something. You need to have a like a model for your poo poo to not be so hard or so
Mhm.
soft. Okay, like this. So basically the 5 things. And then
How
if
how
everything,
can we care for our gut?
sorry,
How can we care for the gut?
for the guts, after 35 years old,
Mhm.
our pH, our acidity inside our stomach changes. It's a physiological not a problem. This is a something that happens. So I use myself as an example. If I eat something that I'm not used to eat, like if I go travel somewhere,
Mhm.
okay, I'm not used to that kind of food, some spicy food or some oily food. I take with me some enzymes, some digestive enzymes. So before eating lunch and dinner, enzymes, and also for premenopause or menopause patients or women, we like to use those to have a cleanse because these digestive enzymes will break all the micronutrients. It will break the fat, it will break the sugar, the carbohydrate, it will break the protein. So you have more, you have the same thing to be observed in a optimal way. Because sometimes I speak with the patient, are you taking some proteins? Are you eating? Yes, half I'm eating, but I'm not observing. Yes, because the pH has changed, and it's not her fault. So she there is some supplements to bring it back. Some shots, some detox shots with lemon, with ginger, with turmeric. They work amazingly. There are pills. So I don't like to subestimate the supplements because I like it very much. And then also you need to know what you need to absorb, what you need to avoid. if you take care of this, your life here will be better and better every year.
You know what? I spoke to many people, different specialities, and everyone agrees on one thing, and that is how important diet, sleep, gut health,
Yeah,
stress levels are for the overall functions of the human body. No matter what organ are we talking about, ophthalmologist, dentist,
yeah,
dermatologist, everyone
yeah.
agrees on these pillars.
Mm-hmm. Yes, and then
So,
in the past, they there was a trend like 10 years ago, 5 years ago, about the low carbs supplements or low carb sweets or even the cereal bars.
yeah.
But when you put something sweet, no matter if it's artificial sweetener or if it's real sugar, no matter what, your body understands that yes, there is sugar coming
Hmm.
to your guts. So the insulin is triggered, and
Hmm.
insulin is a wonderful hormone, but in a huge amount, it's very very inflammatory. Okay, it's yes, it helps you to even to gain muscle mass. Without carbohydrate, you cannot have increased muscle mass, protein generation, muscle generation. But every time, if you are hungry, if you search, if you seek for something sweet, the insulin will be triggered and the inflammation will be there in your body, always craving for sugar, sugar, sugar. You will never be satisfied. Also, it will select the bad bacteria in your intestines. So this bad bacteria will crave for sugar, for something very soft to eat, to chew, because it's very easy, right? It's easier for you
Hmm.
to eat a slice of pizza or a salad.
Steak. Yeah.
See? And then this mechanism, it be always pushing you to low energy, because these
Hmm.
bacteria will consume all their energy, will steal iron, it will steal vitamin D, the hormones that you need to reabsorb for you to be wake up, for you to be awake, for you to be sleepy. It will be there at the wrong place.
Hmm.
Okay, so you need to clean up this one. There is another thing also. It's not that much spread, but it's coming up. It's about the parasites action,
Hmm.
because no, it's very rare for you to get the. When I was a kid, like every year, every 2 6 months,
Hmm.
in my grandma's time, they used to use this or shots or medication every weather, like summer, winter, spring, and fall, because there is new studies of saying about talking about the parasites that steals iron, creates terrible damage in your body, diabetes, thyroid problems. The you don't eat here. We don't have pork, but how damage is the brain with the parasites from the pork. So these nowadays become like, I don't know if it's for. I don't like to say it's for the money, because it is very cheap, very easy to cure. So other things are more developed because they cost more, you can charge more. But I am mesmerized how this was put aside, because you eat outside, right?
I don't actually I never eat outside. Ever since I
Oh,
was a kid,
really?
I always take my food Tupperwares, and even when I go with my friends, family gatherings, I'm always the weirdo with the food Tupperware.
Mashallah. So if you eat sushi, no matter if the sushi is fresh, no matter if the sushi is from a wonderful restaurant, the
Mm,
fish was caught over the sea. So you don't know what the fish is contaminated or not.
true.
You eat salad, you don't know who prepared, if they went through the bathroom and prepare.
Yes.
So it's very annoying for me to close our eyes for this. In Brazil, we have some kind of detectors.
Mhm.
It's very controversial. I won't even mention here. Maybe another time.
Maybe off
And
screen.
maybe another time. Yes, or off. You can see the frequency of the germs of the worms, so you can detect, you can treat them, and then you can have a considerable weight loss, diabetes changing, iron absorption changing, vitamin D, everything. It's wonderful, but nobody cares. It's a shame.
Actually, I never thought about that. Actually, it's
Ooh, I will
interesting. I
send
never
some.
thought about
Yes,
parasites.
this is wonderful because if you go for a stool exam, only
Mhm.
10% will come positive, but you need to be infested. You know those kids that when they sneeze, the worm came up. I don't know if you
Mhm.
ever,
I've never
or
seen
when
that,
they
and I don't
go,
want to see it.
I'll show some pictures. Or when they go to the bathroom and you call the mom to see there's something moving and this was a worm or something.
Mm.
The stool exam only will come positive in that scenario, only
Mm.
if you are infested. So what about the other 90%? They are having symptoms, they are having diarrhea, that no sense diarrhea, they are eating clean, they are eating well. And then when I ask, when was the last time you take some antiparasites? Oh, I never did. Oh, maybe when I was 6 years old. So it's 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 very naive for you to. Everybody have pets.
Mm-mm.
The dogs are on the streets. The dogs are over the bed, the couch, the cats, the everything.
What do you think
So
about? Because I also once read a book where they talk about how people used to eat everything from nature, in a sense, without cleaning it and such. There are some people who believe that maybe eating food in its natural state, let's say fruits and vegetables, if they are not exposed to what do they call it, glyphosates and such, then we can eat them. Do you
yeah.
think it's a good idea, or they might also be contaminated?
Uh, the contamination comes everywhere.
Hmm.
Comes from the water. Um, Here in Abu Dhabi, we have a very small fly, like the fly
Mhm.
from the banana. If you
Mhm.
don't have a banana in your room or in your house, they come from the sink. They come from the
Mhm.
drains. So somehow the water is contaminated. So if you're not sure about how these plants or grains or was watered, was kept until it reached you, you have no clue about
Guarantee.
this. And then also there is the plastic contamination, the
Yeah.
microplastic. So our time has come.
Yeah, and like the plastic contamination is huge. It affects the
Yeah,
hormones, it affects the absorption of nutrients, and it's in
yeah.
everything.
Yes, you can run, but you cannot hide.
Yeah.
Yeah.
Just like glyphosates. The other day I was reading an article about how everything that we have in our life, from clothes, food, is contaminated with glyphosate. And they
Mhm.
are linked to also many other health problems. And as you said,
Yes,
we can't run away.
yes. I like to read a lot of articles, even from the you know, sometimes I see, so this article is more to that side, this article for, but it at least gives you some space to be in between them. Okay,
Yes.
like, I don't know if I was clear. I was reading about the I forgot the
We were
articles
talking
that
about glyphosate.
yes, the about the sunscreen.
Hmm.
That sunscreen causes skin cancer.
Yes.
So, oh, so you don't have the certain answer.
Mm.
So you spend like 20 years using sunscreen, having, yes, lack of vitamin D. So a lot of disease was more prominent during this era.
Hmm.
And then someone is saying that maybe in the future years you won't use sunscreen anymore because they call AGA, the Portuguese acronym say it's product. I forgot. I will remember. So the products that they use for making the
Sunscreen.
sunscreen is worse, causes more
Yes.
cancer than the sun exposure. So this industry behind all the things that they push us to use, it's very strong. This is very strong.
Actually, speaking of this topic, I also have like some debates with friends and such. I never use sunscreen.
Me too. What can I
Never
tell?
in my life. Not only that, I don't wear sunglasses.
Uh,
And yeah, so
uh,
the discussion was I should and such. However, my counter argument was that uh, the products in the market have many chemicals, which our
yeah.
bodies don't know how to handle. So
Hmm.
my idea was that if our food or the food that I ingest is perfect, in a sense, as much as possible, I'm going to be in a position where, just like the indigenous people, where they have great health, they are living in nature, exposed to sun every day, and they don't have any problems. They don't have skin cancer. So
No.
this is my argument.
Yeah. But you know, the pollution is in the air.
Mm.
So in Brazil, no matter you can live in a very bucolical place, but the water is contaminated because of they are mining, they're searching for metals or something,
Mm.
or the everything, the pest control, the I don't know
Yes.
the yes. So the mankind, the population grows so big that it's very hard for you to have like a family business without any poison, without any other nasty things. I think in small places, small countries like Italy or France, sometimes you can.
Yeah.
I heard someone like when I saying that someone when I eat bread in USA, I
Mm.
have some intolerance. When I have bread in Italy, no, because the wheat is different, and it makes sense. Also, the peanuts. Sometimes peanuts you're not allergic to, peanuts itself. You're allergic to the toxins that inside
True.
the barns. So it's something that if you think in every aspect of what you are doing, you become crazy because you cannot control.
Like
Otherwise, you're gonna,
bigger the population, it's harder. Speaking of
yeah,
Italy, if you see like their diet, it's basically pasta, pizza, like bread and such. And the
yeah,
obesity rates are low
yeah.
compared to other
Mm-hmm.
countries where they also eat bread. However, I think the fermentation process and the wheat which they use is different.
Mm-hmm. Yes, the time that the vegetable spends in the barns also is less, so you don't need to use conservatives
Mhm.
because it comes fresher, right? And also the way of life, they walk a lot. Sometimes
Yeah,
the buildings that doesn't have elevator, so it's a way of life that you need to use more your body.
very
Over
true.
here, you need to use your car. It's not a problem. There are some places in Brazil also that you need to have a car. So, but it's something that me, as Rafaela, as a human being, as I live this life, I'm living this era. I cannot control.
Yes.
I have cousins that, oh my gosh, when they start talking, this one I won't eat because it comes from this source. Okay, so let's prepare another thing. Oh no, this one has milk. Milk cannot be
Mhm.
taken. I say, okay, so what's your option? Because there's no more option for me.
Yeah.
Oh, so no barbecue. Okay, because the coal can send some chemical, blah blah blah. Say, okay. So they become vegetarians, but the vegetables are full of poison.
Yes.
One, yes, one did a bariatric surgery. She lost weight. She regained weight because it's only carbohydrates because she cannot eat beef or meat or whatever. I said, guys, look at the hippo. Look at after the elephants. Look the lion. Look
Yeah.
the jaguar. Look the other animals.
Yeah.
We are made to eat, but I understand. Sometimes you need to call them eccentric instead of calling them crazy. But
Sometimes we just have to lay down, like, and step aside, and you can do what you want, and I'll just
yeah,
do what I want.
sometimes you cannot make some fight. You need to be neutral.
You need to be democratic in a sense.
Oh yeah, I can eat everything except pork because I'm really afraid and religious as well. Even not being Muslim, I do believe. Thing.
They have parasites.
I do believe that thing. But I hope the other people won't kill me about the industry, the sunscream. But
So if somebody
it's
knocked
just
on your door and you disagree,
yes.
then I would know why.
No, come. You need to defend science. Yes, I'm defending science, but there is another side, right? Yes.
Okay.
Nothing is only all good or all bad. So it's always there. There's something bad in good things and good things and bad things.
Actually, if I
Mm.
need to go down the rabbit hole, I would actually say that we're just like a product for the pharmaceutical companies, but that's like a
Yeah.
very deep rabbit hole to go down to.
Yeah. Yeah. And a lot of medication. Every Tuesday we have a league. It's a kind of league So we discussed a lot of things about but I do understand also, because when you develop, I don't believe some scientist will develop some kind of treatment or medicine to spoil your health or to make you addicted to something. I really don't believe this. But yes, there is something that they need to be reviewed. They need to be at least shown the cons, because for a certain period of time you don't know the long-term effects.
True.
So yeah, sometimes you're doing something for the best, for the good health, but in 10-15 years you start seeing some other side effects that they are worse than the previous ones, like omeprazole.
Yeah.
Omeprazole is a stomach medication for ulcer, for pain. Okay, but they block all the acidity of the stomach. They make you vulnerable for some bacteria that can live in your stomach and cause cancer. So there's no recall for this drug. There's no to make the patient conscious about this risk, because I'm having a stomach pain. Okay, take this one. No, I'm not digesting, blah, blah, blah. Sometimes it's better. The best thing is to change your way of eating or behavior. Okay. And then you give a drug. Okay, it shall pass. But for long term, for a chronic use, it's terrible. Not only for the stomach, it's for the bones, it's for the blood. So you cannot absorb iron, you cannot absorb other vitamins. You destroy other structures that once you reach 15 menopause like this, you're gonna be like your bones will be pounded.
Yes.
Wow. Yes, so my mom is very hypochondriac, very, very hypochondriac. My mom takes medicine for every single pain or issue or whatever she feels. And this is a problem. This is a very huge problem. If I
Like she's
call
relying
her,
on medication for everything.
yes, if I call her and say, Mama, let's take consideration taking this. She's under like a teeth treatment, but she takes one specific medication. I won't inform which one. And then in America, if you are taking this medication, there is no dentist that will touch, because the bad results, the damage that it can do in your bones for you to receive an implant or for you to receive a retainer or something, it's huge. So she never finishes the corrections, the treatments, and it has been like more than 5 years. And she's still taking the medication. I told her, maybe this, maybe that. No, my doctor said, saying, okay, but things have changed. Well, let's see if you can handle without this medication, supplementing this, supplementing that. No.
It's
But
hard. It's hard to change the
it's
mentality of everyone.
mm-hmm. So, and I asked her, do you feel so much stomach pain to take all this medication? Yes, I do. But sometimes because she eats and go to sleep, eat and lay down, or drink too much water during the meals. So it's very hard. But inshallah, I will change this.
Let's do our best.
Yes, for sure. For sure.
Rafaela, thank you so much.
Thank
This was
you.
really a wonderful conversation. I had such a good
Yeah.
time talking to you, and thank you so much for the information which you presented.
Yes. I'll be always here in case if you need, if you want to come to assess your body with
Mhm.
the in body machine to see how if this homemade meal is doing great for you.
Doing good for you or not? Or do you need to go eat fast food?
Yes. Let's see. Okay. I'll be here to
Sure.
support.
Thank you
Okay.
so much, Rafaela. I very much do
Thank you
appreciate your
so
time.
much. Have a nice day.
Have a
Bye
wonderful
bye.
day, you too. Bye
You
bye.
too. Bye bye.